So somebody asked me in a social setting the other day, what is the biggest challenge that you see to dentistry? I said, man, that's really easy. The biggest challenge that I see to dentistry is actually a mindset. And here it is. It's called my patients can't afford it. If you're one of the folks who are buying into this belief or this mindset that your patients can't afford it, it's affecting your ability to comprehensively diagnose. It's affecting your ability to present the treatment plan. It's affecting your financial arrangements that you have with your patients. It's affecting your financial policies that you have with your patients. It's completely limiting your ability to grow personally, professionally, financially, and for your patients. This, of course, is completely not true. So what do you do about it? Well, you face it head on. The number one thing you do is you face it head on. Realize the translation. When a patient tells you I can't afford that, they don't mean they can't afford it, because you see them go get into their brand new F-150, or you hear about them taking off on their new vacation to Disney, or they're about to take off to, fill in the blank trip or whatever it is, or buy a $600 pair of tennis shoes. When they tell you they can't afford it, the translation of that is, I don't see value in it. What you have to hear is, we, us, me, and the team, we're not creating value for this patient, for this dentistry, for us, or for our time. So, when a patient tells you they can't afford it, they're not going to go into an explanation and go, the truth of the matter is, it's not that I really can't afford it, it's just that I don't see value in it. I see value in the $600 pair of Nikes, or I see value in a vacation to Greece or whatever, but I just don't see any value in the dentistry. So, number one, hit it head on anytime you hear that, or the variations of it. How much does my insurance cover, right? How much of that is my portion? Let me think about it. Let me talk to my husband. Let me talk to my wife, whatever that is. Hear the truth and translate that in your mind. Number two thing you do is, once you understand that that's the case, begin to use that translation to implement behaviors, implement systems, implement processes to be able to create that. The number one place you want to start is on your comprehensive visit or your hygiene visits. Don't ask what is your chief complaint or what brought you in to see us today, or do you have any concerns or any of that. Throw that out the window. Start with, what's the most important thing to you overall about your smile? And you're looking to keep diving into that until the patient tells you really what's on their heart, not what's going on in their mouth. What's the most important thing to you about your smile? Well, I really want to be confident, and lately I've not been confident because here's what's going on. Okay, now we're getting somewhere. Number three, make sure that everybody on your team understands that when patients tell you this, it's not really true. It's we're not creating value. And get them on board with the implementation of the things I talked about in number two. Don't be buying into this craziness. Face the truth, implement those things, watch your practice grow, watch your team grow, personally, professionally, financially, and that's what I want for you. If you want more information about this, you can contact us directly, or you can listen to our webinars. We've got a course specifically around this that's bigger than, of course, a 3-minute video. So contact us, thecrabtreegroup.com. At the very least, click on the YouTube button so that every video we cut will go directly to your inbox. Reach out to us if you want more information about how to create that value and the steps to make it so. I want you to be successful. I'm Sean Crabtree. I'll see you next time.